Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay, well, we've had quite a show this morning. We've had so much excitement here, but this is probably going to be the best part of all. So, Dr. Mencia, you always find the most interesting physicians all over South Florida. How do you do this?
Well, I'm very involved with the educational piece of medicine, and as a national speaker, I travel a lot, and just recently I have the chance of listening to a wonderful educator, Dr. Mudit Jain, who is an endocrinologist. And I listened to his lecture and the way he did his presentation so beautifully, so well put. And there were different level of listeners. You have nurses, nurse practitioner, medical assistant, doctor. And he went to everybody. I said, this is the right person to bring to the radio show, because that's what we want to do. We want to educate people. So we want to welcome Dr. Jain.
Thank you, Dr. Mencia and Anita. It's my pleasure and privilege to join you all this morning.
Well, I'm going to ask the first question here about, I know that thyroid is a very important part of your specialty. And I know that when I go to see Dr. Mencia, you know, he says the first thing, well, I want to test your thyroid to see what's going on. Where is my thyroid and what is it doing?
So, Anita, this is a very important educational piece about the thyroid gland is located in the neck, and it is considered the thermostat of the body. The thyroid hormone is produced continuously by the gland in the right amount, and it circulates in the blood and affects each and every cell of the body. It controls how we burn our fuel, that is the food, to produce energy. And it controls the heart rate, it controls even our brain, our level of, awareness and consciousness. And too much of thyroid hormone can make you nervous, too little can make you sleepy, things like that. So it's a very critical and important hormone. And there's a lot of misunderstanding about it. So it's important to see a doctor and get the right blood test, which is very specific and very helpful in telling us exactly how your thyroid is functioning.
And when they do the thyroid test, Dr. Jain, some people talk about, my thyroid is sluggish. My doctor told me my thyroid was sluggish or my thyroid was hyper. Is one of the two more important than the other one, or should both of them be follow-up with somebody like you? So,
yes, so the underactive thyroid is called hypothyroidism, and the overactive is called hyperthyroidism. And hypothyroidism is much more common. The the sluggish thyroid is much more common, and it requires simply replacement by giving thyroid hormone by a physician prescription. That can be followed by primary general doctors, but when it becomes overactive, it usually requires the help of a specialist like myself, an endocrinologist. Mm-hmm. Now, sometimes patients with hypothyroidism or the sluggish thyroid also need help because becomes difficult sometimes to regulate the dose of the thyroxine, which is a thyroid hormone. Then you can seek help of an endocrinologist as well.
Yeah. And sometimes you get some of the young baby boomers that come to the doctor and they say, I'm so young, I'm healthy, in my 40s, let's say, mid-40s, and they told me my thyroid was sluggish, but I'm going to wait another 10 years to check it again because otherwise I'm healthy. Is that a good approach?
Not at all, because, whenever, it's very simple. Whenever you're not following the doctor's advice, you're missing the boat. And, by not taking thyroid hormone as prescribed, you have higher cholesterol levels, higher risk of atherosclerotic disease, that is where you form plaque in the arteries and get heart attacks and strokes more often. So absolutely, that is very unhealthy. And not only that, you tend to gain weight, get sluggish, and have a host of non-specific symptoms which affect your whole life.
And the thyroid, when it becomes in the goiter form, it can even affect your swallowing.
Oh, yes, it can become large enough to affect your swallowing, but most goiters are not that large, even when you can see them visibly. But it can become large enough to affect swallowing. You can even have thyroid cancer in goiters. So it's important to get a biopsy of thyroid nodules if they're not functioning nodules, which we can determine by getting a scan, a thyroid radioiodine scan of the thyroid. So that all this requires the help of an endocrinologist, and we're picking up more and more thyroid cancer, and it is easily treated, and so goiters like that may need referral to an endocrinologist as well.
And I know you are certified in ultrasound, so you are able to do the sonography on your patient right there at the office.
I'm very happy you're asking about this, because people are not aware. In recent years, about the last 10 years, thyroid ultrasound has become a very potent tool in the hands of the endocrinologist, because it is like our stethoscope or our echocardiogram, like the cardiologist has, because we know how to feel to where the thyroid is and to perform the ultrasound better than even the radiologist, because we know what we're looking for and we can directly see it. So the American Association of Clinical Endocrinologists now certifies endocrinologists with a degree called ECNU, Endocrine Certification in Neck Ultrasound, and I am one of the few endocrinologists locally who has that degree, and that certifies that we are performing the best, following the best techniques in performing ultrasound and ultrasound-guided needle biopsy of thyroid nodules.
Dr. Mencia, I want to jump in here about diabetes, because you cover that many times in your radio shows. Mm-hmm. Why is it all of a sudden, you've been practicing a long time, and even though you're a young kid,
thank you.
Why all of a sudden is diabetes such an important issue? Is everyone eating differently? Are they sleeping differently? Or has it always been a problem? People just didn't live this long?
It's threefold. We are living longer. Obesity continue to be a major issue in our society, and both the third four is both the primary care doctor and the patient basically have not taken the responsibility or diagnosing and following on patient. So, for example, a patient will come in with a very strong family history of diabetes, and people don't want to be diagnosed with a disease, with a condition. So you get patients that will come in and they won't fast the night before. They will fast for 2 or 3 days to make sure that sugar, when they go to the doctor, and they have the food right in there next to them, so they can get that blood test and start eating right away. So they try to fool the doctor because they don't want the diagnosis be put in their chart. But when you do the hemoglobin A1C, which is an average of the past 2 to 3 months, how the sugar had been, then we can still make the diagnosis and detect that the patient do have. So the third fault is really blamed so much on the physician that don't follow through and don't ask the right question. And sometimes the patient don't want to be diagnosed, don't want to have the stigma that, okay, now I'm a diabetic, I have to change my lifestyle.
Well, so diabetes, I was just going to ask you about that. So what are they going to have to do? Let's say you say, well, you're pre-diabetic, or yes, you have full-blown diabetes. Can they, by the changing of their diet and exercise, can they really get rid of it?
Well, it's like treating depression. Before I became an MD, I was a psychologist by training. And before I send my patient to Dr. Jain, I say, before you go and see Dr. Jain for your diabetes, I want you to start seeing the dietitian. I want you to get into an exercise regimen and then go and make your appointment, because now I'm making his life much easier, and the relationship between the endocrinologist and the diabetic patient a better one, because the diabetic feel like I'm part of the solution I'm not just here sitting down at the problem. So, you agree, Dr. Jain, with that?
Very much, very much. Very beautifully summarized by Dr. Mencia, how important understanding the role of diet and exercise in the management of diabetes is. And working with a dietitian is a very important part of that. And it is unfortunate that a lot of diabetics I see tell me that they've never seen a dietitian, even they have had diabetes all their life, and they've never been referred to a dietitian. I think that is an underused specialty, and more primary doctors need to refer diabetics to the dietitian, because that's important.
Well, and it's unusual for you to have most primary care, physicians don't have anyone there. And you send them off to people and they don't go.
And a lot of people get confused because they say, oh no, when I go to the gym, I see a nutritionist. It's a big difference. A nutritionist and a dietitian are completely different.
So tell everybody the difference.
Well, the nutritionist is a person that is educated on what are the proper nutrients depending on what is that you want to do with your body. You want to lose weight, you want to gain muscle, you want to feel younger. The nutritional work on that side. The dietitian is the person that is educated on what is diabetes, what is obesity, what is hypothyroidism, what is constipation, and help the patient manage the overall. The dietitian is a coach. So when you see the dietitian, and I have one case, Dr. Jain, I have one case of a patient that came to me, and I diagnosed her with diabetes, and she is a dietitian. So I told her, I want you to see the dietitian to help you out. She said, I am a dietitian. I said, I don't care. I'm a doctor. And if I have a condition, I'm not going to treat myself. I want somebody else to come with, with an objective eye and
That's
tell me,
very interesting.
to tell me what to do. And, so she said, okay, I'll go for one consultation. She went in and she fell in love with the dietitian.
Of course,
she said,
you have the best there.
Talking about falling in love with dietitians, I don't know if you know, Dr. Mencia, that I have actually married one.
Oh, you did?
My wife is a dietitian and works in my office.
Oh, excellent.
Oh, no, see that? Good. I knew there'd be a love story here somehow.
And she's listening to this show.
Oh, God, hello. What is her name?
Her name is Kirti.
Hey, Katie. All right.
Well, next time we bring you, we have to bring her with you.
Yeah.
Well, I have a question about this. I always try to ask a lot of physicians, why did you of all the practices you could have been your specialty, what made you want to do this? Here you're a young kid, you're in medical school, and you're saying, okay, what do I want to do? Do I want to be an orthopedic surgeon or a brain surgeon? Why this?
See, in medical school and later on in residency, I realized that the endocrine system is the subtle aspect of internal medicine. And there are basically two systems which control the functions of the human body. One is the nervous system, and the other is the endocrine system. So I found the fact how hormones control everything in our body, from metabolism to behavior, I found that very fascinating. And, and that's why I went into it.
Excellent.
That's interesting because mostly people don't say, endocrinologists. We don't hear that word very much, but it does sound like if you examine someone, you can find out so much about them from their endocrinology, from their endocrinology.
It is the hidden subtle aspect of medicine, and it's so endocrinologists are actually good internists because they look at things very intellectually and at a deeper level, and also how the hormones affect their patients' lives and lifestyle, and how lifestyle affects the health.
I had a both of us teach for Nova University. So I have one of the students rotating with me, and we are seeing a patient for the first time. And I said the patient is going to need an ultrasound of the thyroid. We have a sonographer that work there. And I said the patient going to need an ultrasound of the thyroid. And the student say, well, you didn't even touch the patient yet. How do you know? I said, when you do the physical examination, you have to be a good observer. So as the patient talk and I see the thyroid gland moving up and down, I can see a nodule on one side of the thyroid versus the other side. So I can tell you the patient didn't even know she had.
Sure.
I the patient didn't even know she has a nodule in the thyroid. So then the student went and we did a palpation. So you're absolutely right. You have to be a good clinician to be a good
right. The exam starts with inspection.
Exactly.
Visual inspection and then palpation. And sometimes
we have lots of stories about Dr. Mencia
so,
with that.
With diabetes, it's such a huge problem, Dr. Jain. It's such a huge problem. Why don't we educate the audience on what diabetes used to be, not 20 years ago, 5 years ago when it comes to treatment, and diabetes today. There's so many drugs out there now. And the fear in the past was, if I take a pill, I'm going to drop my sugar and I'm going to have a problem with hypoglycemia. What about today compared to 5 years ago?
That's a great question, Dr. Mencia. In fact, we have so many different therapeutic or treatment options available now with less side effects, more potency, and which allow us to, have patient lose weight as we are treating their diabetes. In the past, we had basically two classes of drugs. One was insulin, and the other was a class called sulfonylureas, which comes in a pill form. And both of them caused weight gain. Both of them could cause low blood sugar reactions. Now we have at least 8 classes of drugs. And most of them are either neutral for weight gain, they don't cause weight gain or weight loss, or they actually help lose weight. So, that's why and because the diabetes market is so big for the pharmaceutical companies, we are going to continue to see more and more new drugs or medications for diabetes come out. And that's where sometimes when it gets difficult and the primary care doctor cannot get the patient to goal, it may help to see an endocrinologist. Because really, I don't know if you agree, but it's becoming more and more difficult for primary doctors who don't specialize in diabetes like you do, don't take as much interest in it to follow all this.
To follow all the regimen. And nowadays we have medication that can work at the kidney level. We know that diabetes, we should have said that from the beginning, it's a problem. The gland that we deal with when it comes to diabetes, mainly the pancreas. But the medication that we have now, we have medication that work at the kidney level, in the guts, in the GI tracts, in the pancreas, in the liver. So give us some idea.
Let me give you some flavor of that. So the last class of drugs that has come out is something called SGLT2 inhibitor, which work directly in the kidneys by allowing glucose to be spilled out. That's actually the first, the symptom of diabetes is that excess sugar comes out in the urine. These medications, which are pills, allow more glucose to come out in the urine and help the blood glucose in the blood that normalize. And people lose weight with it, and they have better blood pressure, blood pressure reductions. Then there are another big class of drug is called GLP-1 agonist, which are injectable medications taken nowadays once a week. And they have a multitude of effects, including decrease in appetite, more insulin produced from the pancreas, a suppression of a hormone called glucagon, and slowing of gastric emptying. So there's multitude of effects, and patients lose weight with them. And beauty about both these two new class of drugs is they do not cause hypoglycemia or low blood sugar.
Exactly.
Unless you're taking insulin or these older medications, which may need to be cut back. So more and more now we are using these new medications along with another pill called metformin, which we've been using for a while. So that patients can lose weight as they treat the diabetes. And not have low blood sugar reactions.
And it's interesting because when you mentioned the injectable, the first thing I hear from my patient, I'm not going on insulin. I'm not taking insulin. Is those injectable insulin is the same?
So before you answer, yes. I've got to get everybody so they know who's listening, who's talking. So just hold that for 1 second.
Let's get his information.
Okay. First of all, you've been listening to Dr. Mudit Jain, and he is an MD, of course, but he's also specializes in endocrinology, diabetes, and metabolism. and he is board certified in internal medicine. His office is in Plantation, and if you want to go to his website, it's diabetesthyroidcenter.com. And Dr. Andy Mencia, of course, who is this is his portion of the show every Saturday morning, and it's the Wonderful World of Wellness. And of course, you know he is open on Saturdays, and you know that they have 2 offices, one in Fort Lauderdale, one in Boynton Beach. You can go to his website by going to agifl.com. But if you want to call to get an appointment, you can call 954-489-1345. But you should know that if you need a doctor, you don't wait for Monday and Tuesday. You can go right now and go down to his office. They also have in Boynton Beach their office there. But let me just say one more thing about this, that I'm very proud to announce that his home visit services are really exploding. There are so many people for homebound patients, which is the most wonderful thing you could have done. It's not only for your physician, for your practice, but for the human beings there lying in beds with nobody taking care of them. You know how high I think about what you did.
As a geriatrician, in part I feel guilty as a provider because I said, I never put it together. I said a lot of people move to Florida to retire. And the last thing they want to do is end up homebound, but they do. And I didn't know the number was so high of patients with diabetes, with thyroid disease, that they are basically neglected. They are at home, they are neglected. So we started pushing this program a little bit more. We got very well organized with a manager and a clinical director and so on. We are not doing any marketing. We're doing just getting organized so that we provide the best service possible when we go to the home. So that when the patient, it's like if the patient go to Dr. Jain or come to my office, I want to be able to bring those services right into the home as much as we can. And we are Tri-County now.
Yes, I heard that.
So we are covering from Miami, Broward, and West Palm Beach.
I just love you for doing this. That's my personal thing. Okay, we're going to let Dr. Jain. I needed everybody to know who's on there because people go, who is talking? And, so that's what we have to do.
Thank you.
Okay, so and answering that question.
Yeah, he'd been in his practice for 16 years, which says a lot about a physician that, is well established. And now that he tells me his wife practices with him.
Yeah, that's
now
right.
It makes sense.
As a dietitian. So go ahead and answer that question, please, about the question was about the diabetes and what you...
when we put that, are we putting insulin on? Or
Right.
That's the concern patients have.
Yes, the needle kind of bothers everyone. But for this class of medicines called GLP-1 agonists, firstly are not insulins. They are given as an injectable. Maybe injectable is not the right word to use because when you look at these needles nowadays, they are not more than a mosquito bite. They are, very thin, 32 gauge, we call, and you hardly feel the thing. So I hate to call it a needle because really it's more like a mosquito bite. Mm-hmm. And that's what I tell my patients to get that out of the way. And then I demonstrated to them that how easy it is to do. And when they come by the next visit, they said, "Oh, this is really nothing." So, and the other thing is these GLP-1 agonists are given once a week now. So at least the
for people that are active and working, they just do their treatment once a week. It will never give you hypoglycemia.
Right.
So you don't have to worry about, do I have to drink soda? Do I have to carry sweet with me?
Right. No, but I have a friend that has a pump. And I didn't know that. She's a very active woman. All of a sudden she puts her hands down in between, her breasts and she pumps something. And so we haven't even talked about that.
Now there does come a point, in the lives of many patients with even type 2 diabetes, which is not the insulin dependent kind. So firstly, there are 2 kinds of diabetes. 95% of diabetics have type 2 diabetes, where there is little defect in producing insulin, and the main problem is resistance to insulin or the insulin not working properly. As opposed to type 1 diabetes, which used to be called juvenile diabetes, where people don't produce any insulin and they have to take insulin from the beginning. So even in type 2 diabetes, there comes a point when their pancreas is not able to make enough insulin to overcome that resistance, and they need to be started on insulin. And really, when your doctor tells you that you have reached that point, really there is no choice, unfortunately. But again, it's not a big deal, because I told you the way insulin delivery nowadays is in the form of insulin pens. It's not like the old-fashioned insulin syringe. We have
that you have to draw.
Yeah, right. So nowadays we use insulin pens, which you can carry in your pocket, and just before the meal, to take that little mosquito bite, and you're done. The insulin pumps are being used, and we use them in our practice, and usually see an endocrinologist to get them on, although primary doctors are also starting to use. So they are very convenient, because you don't have to even carry that insulin pen, and you just press a button, and it's very fascinating and interesting to use it. And once patients get on it, they don't want to get off the pump.
Well, you're very fascinating too. And I guess, as usual, we always run out of time, and we're having so much fun. Yes. But it's been great, Dr. Mudit Jain, and of course,
next time we bring him with his wife. So
that would
be a great show.
That'll be so nice.
Great show for to educate patients.
Yeah, that's really a wonderful thing. I'm glad that he'll be working with you at your center.
If they have a thyroid problem, he's so qualified, and his center basically can accommodate.
Yeah, they specialize in this, which is wonderful, with the ultrasound.
If you have thyroid problem, you can call the number, or if you call my office and say that you
right.
But his office phone number, he's been in this practice now for 16 years plus. It's 954-585-6292. 585-6292.
See, I've trained him.
Yes,
See,
thank you.
He really wants to take over my show, but I can't take over his practice, so we
sometimes I have to close the door to clear it outside.
Thank you, Dr.
Thank you very much. It's been wonderful.
I would just say that we call ourselves the Diabetes and Thyroid Care Center of Excellence, and we try to live up to that name.
Thank you. We'll be back. Just stay with us.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.